Hi, I'm Jennifer Leavey, and this is the spring break edition of the Stay at Home Journal Club, where in each episode we describe a recent research article and tell you what was done, what was found, and why it matters in less than 2 minutes. Today we'll be discussing this paper, Characteristics of Pediatric SARS-CoV-2 Infection and Potential Evidence for Persistent Fecal Viral Shedding, that was published March 13th in Nature Medicine by Yi Zhu et al. From Guangzhou Medical Center in China. This paper followed 10 pediatric cases in Wuhan. Most of the children had a low-grade fever, about half had coughing, one had no symptoms at all. In fact, these children did not seek medical care. They were brought into the hospital because of their exposure risk. The main takeaway from this finding was that even after nasal swabs came back negative for these children and they had recovered, they continued to show positive test results from rectal swabs. And this suggests that there might be a fecal-oral mode of transmission for this virus, making it that much more important to wash your hands. I read another paper, this one, which is called Asymptomatic Cases in a Family Cluster with SARS-CoV-2 Infection. And this is a case study from the same medical center in China. In this particular case, it was a family where the father presented symptoms of pneumonia and tested positive for corona. On the same day, the mother and child, who were entirely asymptomatic, also tested positive. The takeaway from this is that a lot of people, including children, can be infected and not even know it, passing the virus along. We'll never really know the extent of this disease until we have a good antibody test in widespread use to determine who's immune. As always, the links to these papers are in the description below, and I'll see you next time.